Hi everyone, this is Big Papa Scott explaining some of the basics of medicine, and I thought I'd start with the heart and how it works. So, let's start out with the very basic thing that the heart actually does not look like a Valentine. It looks like what's on your screen. This is a picture of the heart and how the blood flows through it. The little arrows represent the blood flow. The heart is made up of 4 chambers. The ventricles, which are on the bottom here, they do the main pumping of the heart. And then the atriums, which are over here and over here, and they receive blood to the heart and let the blood into the ventricles so it can be squeezed out into both the body and the lungs. The ventricles are responsible for pumping blood to just 2 places, the entire body with the left ventricle and the lungs with the right ventricle. Now, in most cases, you'll see people talk about blue blood and red blood. And the truth is that blood is not that different in color. It's kind of a maroon and then a red, but it's really very, very little difference. The blue blood is on this side of the heart. The blue blood is on this side of the heart in the right ventricle, and of course coming down from the head and up from the legs and into the right atrium. That's all the blue blood or deoxygenated blood, and it's being sent to the right lung and the left lung. And that's how it picks up its oxygen. Now, once the oxygen is in the blood, it becomes more red and gets dumped into the left atrium here through these 4 pulmonary veins, they're called, and then goes into the ventricle through the mitral valve. I'll explain the valves in a later video, and out through the aorta and down through the rest of the body. I'm just drawing the descending aorta here, the actual thoracic aorta, I guess, or the chest aorta. This is how blood flows through the heart. But there's other things that we should know before we go on to other more exciting things. One of those things is the actual function of the heart and why it's so important that we take care of ourselves so that the function of the heart remains good. The left ventricle, which is again over here, is thicker. You can see how the walls are much thicker here. That's because it's pumping blood all the way through the body. And it has to be thicker and more muscular to do that because it's pumping blood over a further distance, and it needs that extra muscle. Now the right ventricle, which is over here, is more thin-walled. This wall is not as thick, and the septum has very little to do with the function of the heart. The septum is just like the septum in your nose. It separates 2 chambers in the heart. There's a septum for the ventricles, and then there's a septum for the atriums. And when I show you a different picture of the heart, I'll show you the atrial septum. But the right ventricle is only pumping blood to the lungs, so it does not have to be as strong as the left ventricle. So it's thin-walled. It's not as thick as the left ventricle is. So it's very important to know that, because in different heart diseases, both ventricles can be affected, but it just depends upon what's causing the problem that will determine what ventricle is being affected. So let's look at some basic things. A lot of patients that I've seen over the years, one of the most common things is high blood pressure, which is also called hypertension. and this is the abbreviation for it, what we use in schools and in the medical field itself. When you have hypertension or high blood pressure, they are the same thing. There's no difference between the two. You will have what's called hypertrophy, which means a thickening of the muscle, and it's usually of the left ventricle, and what happens is the left ventricle gets even thicker. And so you have all this being muscle now, because it has to pump under a much higher pressure, because the pressure, the blood pressure itself, is higher in your arteries. If it's higher in your arteries, the blood or the muscle of the heart has to work harder to get it into the arteries. And to do that, it's just like a bicep muscle. If you do curling or something of that nature where you're making your biceps bigger, let's say you're lifting weights and you're trying to make your biceps bigger so that you can get more dates. I don't know why the hell you'd want your biceps bigger, but that's your thing. So anyhow, the bicep gets bigger with the more weight you lift because you're putting resistance against the bicep muscle. Well, the heart is a muscle, so if you put resistance against it, like a high pressure, because of the blood being in a high pressure system now because you have high blood pressure, this is what happens to the heart. It gets much, much thicker, and eventually, if it gets too thick, it can start to block off the blood flowing out of the heart, and that can be a serious problem. You can have a very serious cardiac event because of that. It also causes other issues. It can cause problems with the coronary arteries, the little vessels that feed the heart with blood, lots of other things. So if you have high blood pressure, or if you've been told you have high blood pressure, you should have it checked quite often to make sure it doesn't get out of hand. The new guidelines are about, I think, 130/85 for blood pressure. That's the new AMA, American Medical Association guidelines. So if your blood pressure is higher than that, your doctor may change your diet or have you eat less table salt, because that retains water in your body, and it also can cause your blood pressure to go up. So and if that doesn't work, they may give you a high blood pressure medicine. Don't be afraid to take that medicine. In the long run, it could save your life. Being on blood pressure medicine is no big deal. So many people are on it right now. It's amazing. So, if you have to take it, beats the hell out of dying. So take the blood pressure medicine and stick with it. Don't, let it run out. Don't, not refill it. Make sure that you do what you're told and what the doctor says so that you can stay healthy and live out long enough to see your great-grandchildren. So this has been my first video. So this, like I said, has been my first video, and I wanted to let you know that I'm going to try to do as many videos as I can, as often as I can, to let you know how things work in the body. I'm probably going to stick to the heart for quite some time because that was my specialty, and I will explain some of the very basic things, and hopefully I'll get up to more of the significant things, but I will try to explain everything in a way that people can understand. I've been told that I have a talent for doing that. Unfortunately, there are a lot of doctors out there who don't spend time with patients, and don't be mad at the doctors. It's the way medicine is today. They don't have the extra time to spend with their patients because of the way medical billing is and all that other stuff. So blame the insurance companies. So anyhow, I will try to explain things in a way that everybody can understand. I will try to set up so you can put comments underneath each video. I will go through the comments, and if you have a question or if you want to see something explained, I can probably get to that and go over whatever we need to go over and maybe answer your questions. So anyhow, have a nice day, and we'll see you at the next video. Hi everybody, Big Papa Scott here again. We're still on the heart. This is Medicine and You, Easy Explanations. And I figured we went over the chambers of the heart, that it might be a good idea to go over the valves of the heart. So remember, there are 4 chambers of the heart, and there are 4 valves in the heart. So each valve has a specific thing that it does. It can either let blood into a chamber or let blood out of a chamber, depending upon which valve it is. So the one you hear probably the most about out of all the different things is the mitral valve, which is right here. The mitral valve has 2 leaflets, and it's in the closed position here, and it opens to let blood into the ventricle, which is the left ventricle over here, and then it closes when the heart relaxes. Right now the heart is pumping, so right now it's got both of the 2 of the other valves open. I'll explain that in a second. The mitral valve itself is actually a very sturdy valve, but there are people who have what's called mitral valve prolapse, and that's probably one of the more common heart defects. So if you were looking at, let's say, the atrium up here, which is how it's supposed to be drawn, and the ventricle down here, a normal mitral valve would look like this when it's closed. Well, that's a poor drawing, but that's how it would look. In mitral valve prolapse, what happens is the valve itself will go backwards. Come on. The valve itself will, hold on, I'm having trouble here. The valve itself will go kind of backwards into the atrium instead of forward. So what ends up happening is a lot of times people get leakage into the atrium through the prolapse valve. So that's what mitral valve prolapse is. That's probably the best explanation I can give you without actually showing you a picture of the valve moving in motion. We may get to that at some point. There are ways to show you that, so I will look for those and get you some information on them. But mitral valve prolapse is very common. You do see it a lot, or you hear of it a lot. Years ago, it seemed like everyone with a diagnosis of mitral valve prolapse came into the hospital, or came into the doctor's office and had to have their mitral valve looked at because someone heard a murmur, which is an extra heart sound. And a murmur itself actually does not mean that there's a severe problem. It just means that you have an extra heart sound. Some people can have innocent murmurs. Some people can have murmurs that are very significant. Now the next valve we'll cover is the aortic valve, which is the valve that is right here. The aortic valve is shown in the open position here, and it's letting blood out of the heart. So you can see the arrow there where the blood is going out, and then an arrow up here, and you can see the dots there showing you how the blood flows through the aorta. It goes out the different, they call them brachiocephalic vessels, which means that one goes to the brachial artery and one goes, or the other 2 go to the head. So The aortic valve itself has 3 leaflets. The mitral valve has 2 leaflets. One of the things that does occasionally happen with the aortic valve is that about 5% of the population is born with 2 leaflets for their aortic valve instead of 3. And that can lead to the valve being leaky, or it can lead to the valve being what we call stenotic or narrowed, to the point where it gets so narrowed or so leaky that they eventually have to go in and replace the valve. Now, there's a new procedure out there for, mainly they use it in the elderly, but it allows them to deploy a valve using a catheter rather than having to cut the patient's chest open and go through all the hassles with, obviously, the problems that you can have post-op after open heart surgery. So they're starting to use that, which is a wonderful thing. The aortic valve itself is one of the valves that fails along with the mitral valve. The aortic valve, I think, is the most replaced valve. Don't hold me to that, but I think it is. And like I said, it has 3 leaflets. The mitral valve has 2 leaflets. So the mitral valve, you don't see stenosis on or narrowing very much anymore, because we've kind of wiped out a thing called rheumatic fever. When I first started my career, like I said, that was 30 plus years ago, we used to see a lot of mitral stenosis because patients had a history of rheumatic fever when they were a child. So they would come in their 40s or 50s or 60s even with mitral stenosis, and they'd have to replace the valve. So rheumatic fever, now that it's not something that you see very often, used to affect the mitral valve and would make it stenotic, and now we don't see that very much anymore. So most of the time, if they have to replace the valve, the mitral valve, it's because it's leaking a lot, which does happen. So, but again, these are the 2 left-sided valves, the mitral valve and the aortic valve. They are in the left atrium, ventricle, and out the aorta. And the reason why I wanted to point these out first is because these valves are the valves that are most likely to fail in most people. So as age, progresses, which we all have to deal with, sometimes these valves leak a little, sometimes they're a little bit tight. As long as they don't get so tight that you have trouble breathing, or that you can't walk 50 steps without having to stop and rest, things like that. Most of the time the valves hold up pretty well. So now we're going to go to the right side of the heart, which is the side of the heart, remember, that pumps blood to the lungs. So this chamber here is the right ventricle, and the valve that kind of lets blood into the right ventricle is called the tricuspid valve, and the blood flows from the right atrium, which is here, through the tricuspid valve and into the right ventricle, and then goes out the pulmonic valve. So the tricuspid valve, obviously because of its name, has 3 leaflets. Pulmonic valve only has 2. So I call them semilunar valves, the mitral valve and the pulmonic valve. So semi meaning 2, lunar meaning moon, I think. I have no idea why they named it that, but I'm sure someone knows, so just ask someone like a doctor. But anyhow, these 4 valves will open and close millions and millions and millions and millions of times throughout your lifetime. And, there are times when we see patients well into their 90s that don't have any real significant problems with the valves. So they can be pretty sturdy. The tricuspid valve can leak like any other valve. When it does leak a lot, that usually means that there's high pressures in the lungs or in the right side of the heart and the lungs. And that pressure could be from emphysema or from chronic smoking. Any kind of severe lung disease can cause it to dilate. A blood clot that goes to the lungs from the legs can cause the right side of the heart to dilate rather quickly. And that's an emergency situation that has to be handled very quickly. Anyhow, I'm kind of getting ahead of myself, but I just wanted to know that these things all kind of connect together. The heart, we look at it all the time, is based on a circle. It's circulation. That's why they call it, circulation. It's based on a circle. You can point to one point in the heart, let's say right here in the left ventricle. If you're a red blood cell, and let's say that's a red blood cell there, that red blood cell eventually will come back and be in the same position in the left ventricle because it's in a big circle. So it's kind of interesting how that works, and hopefully as time goes on we'll get into more and more things about circulation and how the vessels work, and I'll show you some other things that I think you'll enjoy. For right now, I think we're done with the valves. So now you know the 4 chambers of the heart and the 4 valves that are in the heart. So I hope you enjoyed the presentation, and we'll see you on the next one. Bye.